Good morning, everyone. It is Lisa Collins, and I am happy to be with you today. And we have a special guest. Many of you know her, Jessica. Well, you can see her bio is very, very long. She is so experienced in the industry. So to give you a quick highlight, she has been in the industry for more than 20 years. In the health insurance market, and many of you know she is an industry-wide expert on all these complex laws and regulations to keep employee benefit arrangements in compliance. She joined MZQ Consulting, and she leads the compliance consulting and service team. They are subject matter experts in business initiatives. In addition to her work at MZQ, it looks like in 2015 she launched Forward Health Consulting, where she advised dozens of brokers, employers, associations, and benefit technology firms about health reform and business strategy issues. So I can go on and on. She's written textbooks. She does a ton with NAHU or NAHU, however you want to pronounce it. So I'm going to turn it over. We are on a tight 10 o'clock, we'll end, but Jessica has been very gracious to offer additional time at the end of the webinar to go ahead and answer some of your questions. So everybody is on mute, so if you would please put your questions in the question area. I will be monitoring those questions throughout the presentation and kind of interjecting and stopping her. And then at the end, any questions that we didn't catch or address, we'll do so at the end. This is approved for 1 hour CE. So I did not launch poll questions, which we typically have. That's my fault. So what we are going to do is we're going to ask poll questions like 15 minutes in, 30 minutes in, and 45 minutes in. But you will need to put them in the answer in the question area, not in the poll area, okay? So very simple questions just to show, we've got to show active participation throughout the whole hour on the GoToWebinar report, because that is something we need to keep for our records in case we're audited for the CE. So it is approved for a 1 hour life and health CE. So with that, Jessica, thank you so much for your time. This is such a busy, crazy time for you. We were just talking about it, all this new ARPA stuff and trying to understand it and educate on it. So we're really anxious to hear what you have to say today.
Thank you so much, Lisa. I'm so happy to be here. All right, I'm going to get started because this is a lot. And I will just tell you guys, I did a little calculation the other week because we were feeling so overwhelmed. And I said, this is worse than when the ACA first was enacted and there was all the regs and all the questions and everything. And I realized, first of all, page-wise, if you count the Consolidated Appropriations Act and ARPA together, they're longer. The relevant pages to our industry is longer than the relevant pages of the ACA, because the ACA is there's a lot of stuff in it that's, it actually funds medical student loans and a whole bunch of other things that really we don't think about. That's what made it so long. So it's longer. And then the due dates for everything are so much faster. The ACA, you had almost with everything, the fastest due date was 6 months ahead of time. And all of this stuff is due right now, or the best case scenario next year. So if you guys feel like you're losing your mind, you're not alone. And I have conclusively proven, quantitatively, that we are busier now than we were before. We have more to deal with. So it's not our fault. And that's just the way that it is. So anyway, today I am going to speed talk a little bit because there's so much. I am from New Jersey, so hopefully, you guys are more Northern Virginia used to talking to it. Anybody that's super south and is a little afraid by my fast voice, I am sorry. You can call me afterwards and I will speak slowly. But right now, to get through the hour, we're going to go fast. So we're going to go through the things that are driving you crazy right now, other things you need to know about in the year ahead, other things that are just coming down the pike that we have to worry about, and then questions and answers. And Lisa promised to interrupt me in the middle if there's something that I keep saying, and she's like, everyone's asking questions and they don't know what you're talking about. So put your questions in the chat. Okay, right now, what do we got to do? Cobra subsidies. My son helped me find this icon of a snake. He thought that was funny. If you're not in this, be glad. I'm just going to remind you, if you are, everything that you already are dealing with, because we are getting lots of questions. As you probably know, for some people, Cobra is free now. And that goes from April 1st, so a few days ago, to September 30th at this time. Remember, the last time Cobra was free, they did extend it a bit, but right now we end at September 30th. It applies to everything that Cobra normally applies to, except for health FSAs, because with the health FSA, you're just able to continue your own contribution. So the federal government is not contributing to people's health FSAs, but anything with a Cobra premium, things that are normally subject to Cobra with the premium, that is what is covered. It also covers non-Cobra entities like governmental plans, and then depending on the state, like state's mini Cobra or state continuation law, there is funding for that too that generally runs through the carrier. As you may know, and I get a lot of questions about this, people have new enrollment rights. So you kind of have to look back and say, hey, did anybody not take up Cobra or stop paying us and drop out of Cobra and change their election going back 18 months? If they were involuntarily terminated or qualified because they reduced their hours, then you have to tell them, hey, you have new enrollment rights. So that is an important thing to know. A lot of people are like, if they didn't elect it, we don't have to tell them. No, you have to tell them. You can't be eligible for other group coverage. So if you're on a spouse's plan, if you are, 24 and then you went on your, you could go on your parents' plan. If you are eligible for Medicare, you can't get this. If you're in the marketplace though, or in Medicaid, you can get it. So you could switch to that. I mean, you're going to lose your subsidy from the marketplace and you're going to go to Cobra, but you could get it that way. If that's better for you. And again, it's going back that 18-month period. And yes, that does go back to some people pre-pandemic, but we didn't change the Cobra window. And also that's another thing is those people, if they elect new, but they really only have 2 months left, they come out of the woodwork today and they say, well, I'd like my free 2 months. They do not get any more time. Their 18-month window stays the same. If it is true Cobra, the employer pays it and then gets the money back on a payroll tax credit. If for some reason their Cobra liability, or they may be claiming other tax credits, because there are some now for employer relief. If for some reason they are getting a tax credit for, say, paid sick leave, they can't, and their liability exceeds what they're what they had to pay in payroll taxes, it is refundable, so they can get the money back on their quarterly tax return. One thing that's important to know is you can't double dip. So say you're getting the retention tax credit and you were using it to pay healthcare premiums for furloughed workers, and those people were actually also eligible for Cobra. You can't put them on the Cobra subsidy and get that money and also use your retention credit for that. If you're using the retention credit for other things, then you can. So you can't just double dip, if that makes sense. You can't put somebody on paid sick leave and then also be like, oh yeah, and also they were eligible for Cobra. It does not work that way, and get 2 tax credits, but 1, fine. And then if it's a state continuation situation and they're fully insured and eligible for state continuation, and remember the rules for different state continuations are different, so there may be some gaps there, the carrier fronts it. And then again, you get those payroll tax credits. The one thing that we know now is that the DOL has given us FAQs. They were pretty good. They did kind of correlate a lot of things we already knew. They did add some clarifying details. If you go to the DOL website, I think it's right on the homepage. Certainly if you go DOL/EBSA, which is the Employee Benefit Security Administration, it's right on the homepage. They also have model forms for us to use. You don't have to use the model forms, but I would say it's a best practice. The employers have to meet these notification requirements, and there's notification to tell people about the subsidies and also to tell them when they are done with the subsidies. Most Cobra administrators are, doing your letters for you, but you have to tell them who is eligible. some people administer their own Cobra, and there has been a lot of class action lawsuits and federal case law recently relative to Cobra notices, completely unrelated to this. And people have been losing, like employers have been losing because they've made small mistakes on notification letters. And so it's probably a good idea with this to just use these as close as you can. You may need to modify them because they may not be completely applicable to your situation, and that's okay. My just advice is, if they're there, use it. If your Cobra administrator is doing something else, okay, check in with them. But if you're doing it yourself or advising somebody, a client, about what to do, I would say those models are there for a reason. Some of the things that the guidance has not answered yet is, I get it a lot, is what is this an involuntary termination, Jessica? They did not define involuntary termination yet. It's possible they will. I think the next major holiday, they like to give these things out on a Friday before a major holiday. The next major holiday, I believe, is Mother's Day, which is like a month from now. So hopefully we're not going to have to wait that long, but we may get some more FAQs added. Also, some questions about people that want to appeal if they've been denied this by their employer and the employer says, no, I don't think you've been involuntarily terminated. You quit. I have your resignation letter here. They may want to appeal. We don't know what their, the appeals process is. Another thing is, what if you have a contractually obligated someone to pay their Cobra as part of a severance? What happens there? Because now they can get the subsidy, but then the employer may still kind of contractually owe them money because that was a compensation arrangement. We don't know. One thing we do know is that the outbreak period requirements that give people forever to extend Cobra, to elect Cobra, and then also employers leeway on sending out notices, those dates do not apply here. The notices need to go out within 60 days to notify people about the subsidies, and to cut off your subsidy when somebody's time period ends, you have to notify them between 15 and 45 days of when they will lose the subsidy because their Cobra period ended or the subsidies went away. Those dates remain certain even though we're still in the outbreak period, and people still have 60 days only to elect this. So you have to find them, notify them, and then they have 60 days once they got the notice to elect. Speaking of that outbreak period, we are winding it down. As you may remember, last May, they issued a final regulation and it gave everybody pauses on all kinds of employee benefit deadlines. The thing was, last May, I think if you asked most of us if we would still be having 60,000 COVID cases a day, at that point, they would have said you were crazy and, your kids may not have been back to school for a year. You wouldn't have believed it. So they kind of thought that this would be done soon. And they did this rule, and the rule was based on authority that was good for a year. Well, on February 28th, the year was up. And that outbreak period rule has a wind down period. So after the national emergency ends, you have so many days, depending on what the deadline is. It was going to just end on February 28th. The whole thing was just going to stop. So the Biden administration said, well, that's kind of bad. That's a little bit of a mess. What can we do to not cut everybody off? So they decided to do it on a rolling basis. And it's the triggering event is where their 1 year clock starts. So everybody's is different. So if you had people that were in an election period on February, going back, they still had time, before May. Now they're cut off. If anybody that their window was as of April, what are we, the 15th, they're cut off now. But if somebody got Cobra rights on June 1st of last year, they're still in their outbreak period. So that is going to go on for the next year of winding down the outbreak period. Or if the national emergency period ends, we go back to typical rules where it's 60 days after the end of the national emergency.
Jessica, we have a couple questions. Can we pause here for a second?
Of course.
Okay. So one question is, does the Cobra subsidy apply to a dependent who aged off, meaning that is an involuntary term but not an employee?
That is unclear. Unfortunately, I wish I could answer that, but they didn't answer that question yet.
Okay.
I would say this, I think being more generous at this point, just in general with employee benefits, you're usually not penalized if you are more generous rather than less generous when it is unclear, but it's unclear.
If an eligible individual who previously didn't elect Cobra elects Cobra now, do they need to retroactively elect back to the date that they were first eligible and pay prior premiums that aren't subsidized?
No, they can start as of today and get Cobra, going back to April 1st and get free Cobra moving forward.
Okay. That's amazing, isn't it?
Yes, it is. So you don't have to worry about that breaking coverage.
Okay, ARPA, please help with the state of Virginia and who has to pay, the employer or the carrier? Or then it's a state continuation only. So I didn't, the first question, I guess.
It's the carrier. And and that is, it is a little wonky. Every state's continuation program is different, but they are placing the responsibility there on the carrier.
Okay. And before you go on, let's do that first poll question again. For your CE, you need to answer this. So just put it in the question area, just like you've asked these questions. The first question is, what law or legislation is the most complex for you to understand? It may be ERISA, it may be Cobra, it may be ACA, it may be FMLA. I'm just throwing some ideas out there. So just, what is the most complex for you personally? This is your own.
No wrong answer.
No wrong answer. Okay, we're getting 1, 2, 3, 4, 5, 6, 7. We have 2 more people. Please answer. Okay. It looks good. Go ahead. Thank you.
Okay. Open enrollment and premium tax credit. Okay, so basically the Biden administration created a new open enrollment period for anybody on the federal marketplace, and all the states with their own state exchanges did the same thing. The dates are a little different because state-based exchanges can make up their own dates, but basically everyone can get on the individual market now with an open enrollment period. Now, this is just, if you're in the individual market, obviously you are working on that right now. But if you're in the group market, this is something I think that everybody just needs to think about. So ARPA also makes exchange-based health insurance premium tax credits available to more Americans. It used to be up to 400,000, 400% of the federal poverty level, but for the next 2 years, they say nobody's going to pay more than 8.5% of their income. Now, on the employer-sponsored plan, obviously that's an ALE. You have to make it affordable, and it's based on 9.5%, and every year that is escalated for kind of inflation. There's a calculator for them, so it's always different. It's always a little excess of 9.5%, right? And we don't know what 2022 is going to be, but there's roughly a percentage point of difference there. And employers don't have to be responsible for household income, which is what the exchange uses. So that's 8.5% of household income for the exchange. So that's why we have safe harbors. But what I wanted to just point out is that it's going to vary by people's income because of what premium they pick in the exchange and stuff, but more people are going to be eligible for exchange-based subsidies. And if your employer insurance is not affordable to you, that would qualify you. So employers have safe harbors, but they've got to know more people may be going to the exchange. There's also a lot of promotion about it. You just may be drawing more people there. So if you are, when you change that, your liability risk might go up. A lot of employers, if you are concerned about this and you're very risk averse regarding the subsidies, you want to make sure your employer contributions are spot on, and you want to be clear on your safe harbors, because you may just have more people get a tax credit and then be flagged for it, and you may have to answer questions when the letters come out for this year. Or if some employers just say, we know a couple of employees of ours are going to be eligible, and there's, we have like 2 of them and we're fine with that. And if they go to the exchange, we'll pay the $3,000 for them, and that's worth it to us. Just know that there may be more of them this year because you just don't know about eligibility. And is the employer okay with that? And when you kind of, are you going to meet your percentages in terms of people, you know, is that going to be okay with them? And there's going to be different employers that are going to accept the different degrees of risks. As brokers, I think you can show value by just pointing that out and having that conversation. So just keep that in mind. All right, Section 125 plan relief. I don't want to go into all the things because honest to God, they keep on adding new ones. This is the thing. We all know since last May, when they started giving out notices saying that we are creating DCAP change, health FSA changes, dependent care changes, new open enrollment periods are allowed, mid-year election changes are allowed. We keep on adding things to the list of qualified medical expenses. They have allowed a lot of changes. There are going to need to be plan amendments for employers that elect them. None of these affect non-discrimination requirement testing for your Section 155 plan. So if you up limits or allow people to keep more money, then it may affect your non-discrimination testing. So employers should be aware of that. There is a lot of effort that goes into having allowing new election changes mid-year or changing things. At some the medical expenses need to be changed for account-based plans and some don't. Some account-based plans, Section 125 language says, anything on the law, like it ties it to the law as opposed to a specific list. This is just kind of a good chance to look at the plan documents or talk to people about that, why they have a Section 125 plan, talk to their administrator, make sure that they're aware that they're probably going to need to make plan amendments if they changed anything. They do have a decent amount of time. The first deadline that comes up is if they did, ARPA allows you to lift your dependent care limit up to $10,500 for calendar year 2021, which means that if they rolled over, all of their money or had an extended grace period, people could have up to 15.5 in their accounts for this year, which again, could create a non-discrimination issue. But if they do raise up that DCAP limit, that needs to be done by the end of this calendar year, so by December 31st. Everything else, you usually have 2 years from when you made the change to do it, so people are still well in their window. But just know that this is coming up and that there are going to be amendments that are needed. You do have those non-discrimination issues. And then I know a lot of brokers have different feelings about these, as do employers. I will just say this, it is an administrative issue and you should really consider return on investment. So if you're going to raise your DCAP limit for one person, so one person can take advantage of it, does an employer really want to do all of that? Or another thing that they need to consider, not just non-discrimination testing, but if you hear about all this and you have employers, HR people, they may be very active and up on things, but they don't think it through. You don't want anybody to allow one person relief because, Susie comes in and she's complaining about her daycare expenses and the, HR person is like, oh, I heard that you could raise it this year. Susie, you can start putting more money into your dependent care plan. No, you have to do it for everyone. So if they're going to do this, they do it across the board or at least across classes of employees. So just be careful. Also, it's all optional. No one has to do any of this. All of that FSA relief is totally optional. So again, many employers doing it, they want to do it. It's super helpful. I know when I was sending someone to daycare, $5,000 was very little of my cost. 16.5 was a lot closer to what I was actually paying out. I would have been thrilled if I could have had that. But I also know that it's complicated for people. So think it through. All right, paid leave, also optional, still optional.
Before we get to paid leave, can I ask a couple questions on that section?
Yes.
Okay, all right. So you don't mind me interjecting this way?
No,
it's good?
No.
Okay.
Yeah.
If someone enrolled on exchange in 2020 but did not apply for APTC during the application process, so they paid the full price, can they still claim the credit for 2020?
Okay, so they enrolled in, I'm sorry, can you repeat the question?
Yeah, sure. Enrolled on exchange in 2020, last year.
Oh,
But
yes. Yeah, the expanded premium tax credit goes back to this year. So it's for 2021 and 2022. So as of 2021, if they're enrolled now and they weren't getting it, so they enrolled this, like, so it doesn't apply back to 2020, the expanded credit. But if they were a higher income person, didn't get a subsidy on January 1, for January 1, they can get it retro back for this year, to what they paid to date.
okay. Any recommendations on best practices for distributing model notices for small employers?
Well, I think that the really the standard with notice is reasonable, like a reasonable receipt, like that you're reasonably be sure that they receive it. So US mail is a completely, definitely reasonable receipt. Handing it to the physical person is a reasonable receipt. There are other ways to do it via electronics, but then you have to either worry about safe harbors or, like you just have to worry about that. So, I mean, I think that mail or physically handing it to the person is always the best way.
Is it 8.5% of income for family or individual?
Individual, or no, family income, your family income for exchange.
Can an employee get Cobra after 60 days of layoff? Sorry, after 60 days of layoff.
Well, the person, say they were like laid off, more than 60 days ago, and they're now eligible for the Cobra subsidy, but they have to be notified by their employer, and then they have 60 days to elect. So if they get the notice from their employer and then they don't elect the Cobra till later, no, the free Cobra. But if they had, and if you're already on Cobra, you have a different notice that you give them, and then they fill out the form and they say, yes, I want the subsidy. So if they miss their deadlines, then no, they're not going to get the free subsidy. But if they've just been laid off and not taken Cobra for more than 60 days, yes, because you get that new bite of the apple.
Makes sense. And then your one answer presented another question. If you hand out notices, should you require a signature from the employee on receiving it?
I mean, it's definitely a good best practice, sure. Yeah, because you want to make sure yeah, that's, I don't think that's a very bad idea.
Yeah, document. Okay, thank you.
Sure. Okay. So anyway, paid leave from your perspective, if the employer kept doing it, it did expire on December 31st, 2020. Some employers kept it up, but then they said you would still get the tax credits on December 27th if you kept it up, but it was optional. If they're still doing it, they can still get the tax credits. The Biden administration, with this, well, not just about ARPA, also added some new things from the employee perspective. First of all, that paid leave, that 10 days reset on April 1st, and you have new ways that you can qualify for the paid leave. If you, need to take get your vaccine, all the old ways are still there. Like if you're quarantining, you have COVID, what have you. The 6 ways that were there before, still there. And now you also can use that paid leave to get a COVID test, get your results. If your employer says you need to go get a COVID test, you can take this paid sick leave for that. So the employer can send you home and get the credit for that day. If you're getting the vaccine, you can take a day off for that. And also if you are, on your second Moderna shot and you collapse the next day in your backyard like I did, but I was fine. It's just a little surprising. You could take the day off of work and also claim this paid sick leave if the employer is eligible. The eligibility criteria didn't change, it's still less than 500. The other thing that it did was that family medical leave, expanded family medical leave. Now you can take it for not just childcare related things. Last year it was just to, if you had to be an involuntarily homeschool your child, you could take the weeks off, or you could take it intermittently. Now you can use it for all of the paid sick leave reasons and the childcare reason. and they're not using that 2-week elimination period. So it's for the whole 12 weeks that someone can take. Now, the terms of the resetting with that, it's all tied to existing family medical leave. So family medical leave, starts the clock on the 12 weeks when you take it. So if somebody took it last year and then, last April or May when they were eligible, they're going to get 12 weeks again if they used up all their weeks before. So we have that going on. Again, this is optional. Employers do not have to allow this anymore, but if they do, they get the tax credits like they did last year. All right, business relief, I'm going to quickly go through this. PPP was expanded again, and we have those second draw loans. That happened with the Consolidated Appropriations Act back in December at the end of the year, and ARPA just gave it even more money. There's new forgiveness taxes categories for it. So basically, it is very hard to not get your whole loan forgiven because there's so many different things you can use it for. It applies, you can use it for healthcare costs, to pay people's premiums. There are complicated calculations to document that on the application. And then for forgiveness, so that's why brokers are often involved, because their client that got the PPP loan was getting the PPP loan wants the information about their premiums to be able to document, what their costs are and then how they're repaying. But that is out there. So is the retention credit, and they made it a lot better. Now you could get a PPP loan last year and use the retention credit this year. You just can't double dip on the same money. They have made it like you can use it to help pay for working employees now. If you have up to 500 people, it used to be 100. So now a lot of more businesses can use this to help offset their costs. You just have to require a gross revenue decline of 20% compared to last quarter. And they've upped it, and it lasts through the end of this year. And it is $7,000 an employee, and you can use it for their salaries and their benefit costs. This is where it gets sticky with Cobra. If you're using it to you can't use it to subsidize somebody's Cobra premiums and get the Cobra subsidy. But if they're on Cobra, they could get the Cobra subsidy, and then you could use it to pay for people that are still working. People with over 500 employees that furloughed people or reduced their hours could use it to, to pay people to basically stay home. And that's, again, where you kind of get into that Cobra subsidy overlap. Mental health parity compliance, I am going to go through this as quick as ever. I will tell you, I am sort of obsessed with this. I did a free webinar on this with my company last week, and I can send you the link to it if you want to, if you're really into this. I'm also doing one for NAHU not next week, the week after. Their Compliance Corner webinar is going to be about mental health parity compliance. Spoiler alert, we're using the same basic slides, so the presentation is going to be pretty similar. But this is the thing. Okay, because of the ACA, practically every fully insured group there is that's not grandfathered has to comply with the Mental Health Parity and Addiction Equity Act. Originally, it was just larger groups, but now it's the way the ACA applied it. It hits practically every fully insured group. And most self-funded groups have to do this too. Like smaller level funded groups are one of the only categories that don't have to do it. Also, mental health parity applies to Medicaid, CHIP, state plans, unless they opted out originally, church, so like a lot of church plans. So many entities are subject to mental health parity. And they've been subject to it for 13 years. One of the things that they always should be doing is demonstrating that their non-quantitative treatment limitations, which are all the squishy things in a plan that aren't really obvious, like having a deductible that's separate for mental health, that's quantitative. Most plans have scratched all that stuff and made sure their cost sharing is level and things like that. But then there's other things that plans do that are squishy that often are out of parity. And sometimes because they just are, because sometimes it's people's choices. But just as like an example, how many of your in-network claims are for medical surgical benefits versus out-of-network? Compare that to mental health and substance use disorder treatment services. They may be way more out of network, right? And that may show that you don't have an adequate network. It might show that people like to go to substance use disorder treatment clinics away from their home. I can't say. There may not be one in your area. It might show that nobody wants to contract with you. Things like provider reimbursements rates, formulary design. You know, do you cover like 12 drugs for stroke treatment and 1 for ADHD? Stuff like that. Step therapy, all the things. So there's a bazillion NQTLs, and fully insured BUCA plans were like submitting plan designs in the small group market, large group market all the time that were not compliant. They found that like 60% of their violations for parity are for this. So anyway, basically after 13 years, the DOL and the federal government were like, we give up. You people are not complying. The law has been on the books forever. You're just not doing it. So now we're going to force you. And they have made this their top enforcement priority for the year. Every carrier fully insured has to have an analysis, very super detailed, and every employer plan, self-funded or fully insured, is also responsible for having an analysis. If you are if they're subject to mental health parity, if you're like a group of 20 level funded plan, you probably don't have to have it, but everybody else like does. So the thing is, there's no way in the world the employer can do this by themselves. They need the cooperation of the carrier, the PBM, you know, whoever does the utilization management, all the things. So if you are, for your fully insured clients, tell them that they need to have it. Open secret, no one did this already. It was due on February 10th. No one has done it. If you've got fully insured groups, go to the carriers. Be like, what are you doing? When are we getting this? Because they have to produce it too. On the fully insured side, they have to be able to turn it in. The insurance departments want it, like, you know, and the penalties for not doing this are super high. And then on the self-funded side, it's the plan sponsor, it's the employer that has to do it, but they need the cooperation of the TPA and then the vendors the TPA uses. So go to the TPA, look at your administrative services agreements and say, what are you doing for me? And pro tip, if they're like, we're going to do a quantitative treatment limitation analysis, as one ginormous national TPA said, and it's $3,000 for everybody. You can say, okay, that's lovely, but that's not what the law requires. We need the NQTL analysis. Where is that? How are we getting that? So get that, because there are $100 a day penalties. The government's going to publicly shame the people that don't do it, but also they'll reprocess all of your claims. So it is really big deal, and you have to tell all of your plan participants if they find you to be non-compliant. So
we're going to pause just for a second for that next CE question. So thank you. In the question area, I got a couple questions. Where do I put it? In the question area, answer this question. What's your favorite dessert? In the question area, what is your favorite dessert? Not resort, dessert. I got vacation and food on my mind. Everybody's answering this a lot quicker than the other one. All right, almost done.
Okay.
Okay, thank you.
All right, other things, so that's all stuff you have to deal with right now. Other things that just are on your plate later this year. Price transparency. Okay, two kind of parts of this. One, the Trump administration made a final plan transparency rule due on and it has a deadline on January 1st. There is actually 3 deadlines. They're January 1st this year, next year, and the year after that. But this coming January 1st, January 1, 2022, all fully insured carriers and all employer groups plan sponsors. So again, if you're fully insured, your carrier is going to do this, and you have to figure out like how they're doing it, because you have to put something on your website, like, you know, or like link to theirs or something. And then if you're self-funded, again, the TPA, like no employer group has access to this information. So you need to go back to the TPA and say, how in the world are you going to do this? Because what they need to do is make 3 machine readable. So that means like you and I would not be able to look at it. You click on it and it's gobbledygook computer code, but you put 3 files and on the computer on like a website or something, and they have to maintain the data, keep it updated monthly. And on one file, and there's more details about all the things that need to be in these buckets, but in one of them, it's all of their in-network provider negotiated rates for that group. 2, this is where it's group specific, the historical out-of-network allowed amounts, and like they have to, and it's like a look back method, and it starts in basically August that you have to start collecting this data, and they de-identify it. So it's like tricky to make sure it's de-identified. Like if there's not enough claims in a CPT code, then they don't have to put it on. But like every month that might change, because you know, like that could get to kind of expose PHI, they think, if they didn't. And it is all de-identified, but just like if only one person is getting whatever claim, they could probably figure it out. So they don't do that. And then all of the prescription drug pricing information from the PBM, so like the rebates, like all the things, they have to get this and get it up there. And again, in the fully insured side, the employer group plan can transfer their liability for this to their carrier. I'm going to tell you the way that it's written, the carriers are going to charge for this, and they can. And that's what you're going to see in your new, agreements for 21. When you renew, expect a fee for this, and also expect some type of agreement and ask for it. How is this happening? Where is my employer group going to link to this? Tell me, United or Blue Cross or, Aetna, where do we go for this? Because we need to have it to be able to point to it to satisfy our obligation. And then if you are using a self-funded, chassis for any of your groups, you need to go to the administrative service organizations and say, how are we doing this, folks? Because it's the employer's responsibility, but there's no way the employer can do this themselves. So that's fun. All right, plan transparency also required beginning on or after January 1st. We are going to change the ID cards. We have the deductible, the out-of-pocket maxes all on their phone, web addresses. So a couple of things that, again, you want to know. If you are working with a TPA, you want to make sure that they're up on these requirements and those cards will be printed appropriately. Fully insured plans, I think they've got it, but you just want to make sure. And I don't know about you, but it always strikes me as one of the crazy things in our industry of like how long it takes to get cards done. So just, you might want to check and make sure that this doesn't like delay things, because that's always annoying. All right. Another thing that is due this year, January 1, is we're going to have these advanced explanation of our benefits online that people can get before 1 to 3 days of their services. So they have to be able to get on your online and see all of the specific data to them, kind of advance of what you'd see on an EOB before you incur the claim. So if you are going to be booked to go in for surgery, on Friday, by like Wednesday, you should be able to see all this stuff ahead of time online and look to see, and it's specific to you, like where are you in your out-of-pocket max? Where are you in your cost sharing liability? And then a good faith estimate, all this stuff. And again, the fully insured carriers, they have to do it, and the employer plan has a responsibility to make sure their carrier is doing it. If you are self-funded, technically it falls on the employer to get this done. The TPA has no liability. Again, how in the world would the employer do it without the TPA? So you guys need to go to them, look at those ASOs, see what it is. My guess is they'll do it for a price, or there may be a service addendum, or your PPM is going to go up to pay for this. So keep it in your mind coming up January. Surprise billing, also effective January 1, 2022. On the consumer side, it's great because you're not going to get balance billed for out-of-network emergency care, or if you are in, in a fully insured, a network facility. So you go to a network hospital and all of a sudden the radiologist is out of network and you had no idea in the emergency room, and you're getting billed for that. And also air ambulance, not regular ambulances, which are almost never in network. So the patients hold harmless. They're only allowed to be charged their, cost sharing for in network, and you're not allowed to charge access to the patients. The thing is, what do you do for the rest of the money? For the first 30 days, the health plan and the provider get to negotiate like normal. They can do anything they want. So like this is where a reference-based pricing situation, they do their thing. But if they can't agree, then you start this independent dispute resolution process. It's baseball style. There's one winner, one loser. There's different things that the arbiters can do. And that, and that's like the next thing. So from the patient side, it holds harmless. From your side, what do you care about? Okay, a couple of things. Who are these arbitrators? What are they doing? We have no rules on this. And then from a fully insured side, again, it's going to run through the carrier. So you just want to make sure that your agreements are accordingly. You may need some changes to plan documents because claims procedures may change here. On the self-funded side, you need to make sure that they're doing this. Where is the employer going to get involved in terms of making that decision about what to pay, and where is that going to be drug in? How is that going to, who's going to pay for the arbitration, things like that. That's going to be part of your ASO. And again, plan documents, like the underlying base plan documents that people have, may need to change because of claims procedures changing. So those are some considerations for you guys in the future about this. Comp disclosure. This is your comp and other service providers. So any contracts that you enter in or on after December 27th of 2021, you are going to have to give every group or individual you work with a now there's rules to extend this down to the individual market yet. We don't have those exactly, but for groups, you are going to give every group plan sponsor that you work with, that where you make more than $1,000 from that group in direct or indirect compensation, a document. There is no form yet, and we don't know if there's going to be a form, but you have to describe your services, all the comp you get, indirect and direct, your relationships, who the service providers are all, who pays you this money. There is a whole format that you need to follow. So just key points, no actual form yet, and what you expect to get from them. You have to make it in advance of when the contract is made, or if you make changes, or as soon as it's practical, which means pretty quickly. It's the thing that's interesting about this is your employer needs, the plan sponsor needs to get it, and if they don't get it, they get penalized and they have to tattle on you. And so this is going to be part of the DOL audits for employer plan sponsors moving forward. So they have to be able to produce it. So on the employer end, this is a compliance requirement for them too. So if you're a broker and you're smart, you might be like, here's my document, and you should be looking for this from your Cobra vendor, from your TPA. Practically anybody that gets money from direct paid off of their health insurance contract is covered here. So the covered service provider definition is huge. So your groups should be getting these documents next year and have a plan to store them and know what to do with them. And if they don't get them, they have to complain to the DOL by a certain date or they are penalized. So you can educate them about that. The rules for that are, probably coming on what the employer end does, but from our end, what we have to disclose, that's all in the law. And they said we're only doing regs on, for sure, on the individual market side. But on the group side, you should have all that you need. We may get more guidance this summer, we may not. So you have to be worried about it. The other thing is, think about it this way. Yes, it's a pain. Yes, it's like all the things, but it could also be a competitive advantage, because if somebody else's broker, you're trying to get a BOR, one of the things you can ask is, did the broker come to you? Did they give you this information? And did they help you make a plan to keep you compliant so you don't get in trouble for all of your service providers? All right, this is a really scary one coming up, and there are going to be rules on this, and no one knows exactly how this is going to go down. Please don't get mad at me. The rules are coming out this summer. It is technically due at the end of this year. So I like to call this the 55,000 because it's a bazillion times worse than the 5,500, and it applies to, approximately like 100 times more employers. But it goes down to all size groups. So we're going down to groups of 2 here. Everybody's going to have to file this annual disclosure with the federal government. How they're going to transmit it and when, we don't know. I think it's reasonable to assume that they're going to build on the 5500 EFAS platform because that's what they did with employer reporting. And then this also goes to the DOL. So I think it's reasonable to say that they're going to use something similar. The difference between the 5500 or ACA reporting is that this is information that no employer can really get all by themselves. So you need to get this from your carrier or your TPA, but like kind of like a plan document, it includes employee specific information. So, and the employer is the one that has to do the filing. So you're going to want to get the information and then the employer is going to have to bring it back. So we don't have the details on this yet of like how and when and whatever, but we know it's coming. The carriers know it's coming. The TPAs are coming. I'm assuming the PPMs are on this. And you're going to be like, they're not going to want to give this up information, Jessica. They're going to have to. And it's group specific. So it's, it's group specific. So you have to put your plan year, your enrollees, some demographic information about the group. But then you have to do all of this drug data about the top most prescribed drugs in the group, the claims for each, the most costly in each. And I mean, I know you're like, but I have an 8-man group. They don't even have 50 drugs, I think. Yeah, I know. And do they need this information? Like, what does the employer do with this information if it's a tiny little employer? Like, what if there's discrimination charges because they found out that so-and-so was taking whatever? Yeah, I don't know yet. No rules. But anyway, they also have to put all this claims data in there too, not just about drugs. So other costs like hospital costs, primary care. So it's both prescription information and other claims data. And remember, they are pulling out that claims data for other things. So the carriers and the TPAs are aware of this. But again, this isn't even like where the carrier is responsible to. This is data that each group is going to need to get handed to them and then kind of put in their pieces and then file. I am sure there are going to be vendors that will do this filing like there are for employer reporting in 5500s. I will say that there's quite, what if they put in something wrong because the PBM gave them wrong information? There are, probably going to be safe harbors for them. But this is going to be an employer responsibility starting sometime next year. And right now, it goes down to 2. It could get delayed because the federal government has to build a system to take it all in. They could put a cap on it and say, like they did with W-2 reporting, like maybe they'll set an artificial threshold, like 250 or something like that. I don't know. And what are they going to do with this information is what everyone wants to know. I don't know. I don't know. They supposedly make our prescription drugs cost less. I don't know. Okay, so that's all the stuff right this minute. Does anybody have any questions about those? Should we do a poll questions about that? And then I will quickly run through the other things that are coming.
Okay, I have one additional question, I think. Well, 2. I just wanted, this is a comment, Jessica, so you'll appreciate this. I just wanted to say that I have found this information and the speaker knowledgeable to be extremely valuable. One of the very best CE offerings I've ever participated in. So thank you.
Well, thank you. You've made my day.
Is
Lisa,
the data?
You can call back and like audio that, and we'll just beam it out to my family so they can see.
You can post it on your website. And at the end, we would want to know what you can offer towards all the stuff that you're speaking about. It says, can you remind me on the comp disclosure, group size or all comp over 1,000?
No, it's based on all, no, so each group, so you could have a group of 2. If you make more than $1,000 off of that group, you have to tell them about it. So each group, you have to figure out how much money you make off of that group, indirect and direct. So, it's one thing to just tabulate up your commissions on that group, but then you have to think about indirect comp that you might get and how it's attributable to that group. And also, like, say you get, I don't know, like say you get some type of, you have your commissions, but then maybe you got some type of like finder's fee or something like that because you sent them to like a vendor or something. Like, I don't know, but like that also counts. So you have to think about that and like where you're getting from. It might be from multiple sources.
Sure. Is the data, and I don't know because this is further back at 940, is the data available by a secure member login or is it available for public viewing? Not sure.
Okay, so the employer, like the advanced EOB stuff, the employee, yeah, you like it would be a participant would log in, and there is some like, you know, you can't bury it, it has, you know, like that type of stuff, but yeah, you could have it you want a portal or something like that. So it's not just like out there because you are pulling up, when you look at that, it's specific to you. So you're looking to see where you are in your maximum out of pocket limit, like where, you know, that where you are in your deductible.
Right. Okay. And do you have to disclose the actual amount, going back to the comp, the actual amount, or just state over 1,000?
Actual amount.
Somebody just said, I think I'm in the wrong, or I'm getting out of this. I think I need a new job. All right, that's it.
We're gonna, yeah.
Let me ask the final question so I don't have to interrupt you again and let you go the rest of the time. Let's see. Are you a lake, beach, or mountain person? Again, now we do 3 questions just in case one didn't come through or something happened. So lake, beach, or mountain?
Lisa, what a tough question. I've always been a beach person, but during the pandemic, my mother-in-law had a lake house. It's in in Canada, and we can't go to it. My husband convinced me to buy a lake house in the mountains, and now I love it. So people, I mean, there is no wrong answer. I don't even know what I would say.
Where do you get a lake and mountains in this area?
So, well, I live in Pennsylvania, and so it's in the Endless Mountains, which is like kind of between the Catskills and the Poconos. So it's really just, you know, Appalachian Mountain, you know.
Right.
And we have bought a house on Laurel Lake, and it's a
It's
little,
wonderful. Yeah.
like 100-acre lake in northeastern Pennsylvania.
That's a nice size.
Yes, hopefully my children are thrilled. At this point, we're still we bought a lake house that was furnished, and it's kind of crazy, and the people kind of were a little bit hoarders, and the yard is a mess. And every time we go up there, they're like, you got us a lake house, but it's like chore camp every time we go.
It will get there. It will get there.
So hopefully when it's warm and we can actually swim in the lake, they will be happier with us.
All right, we have one final question, then I promise you can get back. ARPA again, under Virginia state continuation, would the look back go back to 4/1/2020, unlike, oh wait, it just jumped on me, sorry. When people respond, it jumps and then I lose my spot. Would the look back go back to 5/1/2020, unlike Cobra back to 11/2019?
Okay, so that's like kind of interesting because the state continuation rules are all different, right? So it seems like this law, like that's one of the things that's unclear. So like it uses the Cobra period for Cobra, but then, you know, it just kind of did not take into account the fact that every state's continuation program is not the same and does not mirror Cobra exactly. So it says that it goes on the state continuation rules, but like that's something that's a little unclear right now. So I wish I could answer that question, but that's a question I've had asked, you know, before. And we did some research and we're like, you could kind of read it one way in that they give you the 18 months, but the 18 months is clearly based on the Cobra. So I'm sorry, I wish I knew, but we just don't know. That's why we need more FAQs.
Mm-hmm.
And that's just like kind of the story of our life. I feel like we also say, I don't know a lot in this time because, you know, it's just uncharted territory and there's not necessarily guidance to answer all of our tricky questions.
For sure. Yeah. Okay, I think that's it for just another very positive comment that this is very helpful. So go ahead and we'll end on your presentation. And then please at the end, let us know what your consulting services can accommodate to.
Okay, sure. So this is, so these are just some things that, this is quick, like we're almost at the end, but I just want you guys to remember are still coming down the road that we do need to, that could happen this year or could happen, you know, soon. So one of them is they are revising the HIPAA privacy rules. That's kind of under active consideration now. There's a proposed rule out. It doesn't really touch us in a lot of like where we comply with the privacy rule, but it is designed to make it a little better for beneficiaries and kind of ease the standard for particularly doctors with giving up the information. And like a lot of it is aimed at people both in a value-based care situation so that they can share information easier, and then also in sort of a substance use disorder or like mental health situation where you may have, I mean, it was really kind of stemmed by like the opioid epidemic, and you may have like parents or siblings and adult children and trying to help, you know, like help their siblings or like an adult child or something like that. And the person's over 18 and they don't, you know, and maybe they're like 45 and they just didn't have an authorization. I mean, I know I have a daughter that turned 18 and she went to the doctor like the day before her 18th birthday. And I was like, can we have the paper so she can just make me, like, she doesn't do, you know, she's not responsible for any of her bills and stuff. And she doesn't really do so well with her appointments. I need her authorization right now. And they were like, okay, fine. And I was like, you will give this to me whenever I want it. But eventually she will be old enough that I don't have to demand that from her. And if God forbid she needed something, it's designed to kind of like ease that and give them more discretion to help information. So that is coming. Group wellness plan regulations. So you guys may have remembered that the Obama administration tried to deal with that safe harbor relative to GINA and the ADA, where we have health contingent wellness plans and like what really is genetic information if you take a family history, or how do we accommodate people for the ADA with alternatives. And they tried to do a safe harbor for groups, and then they got sued and it did not work out well for them. So they said, we have to scrap those rules that you did and you need to redo them. But it was like right at the end of the Obama administration. So they said they thought that the Trump administration would do it, and they gave them like actually a year to get it done and said, we'll keep them for a year and then by then you'll have new ones. And then the Trump administration just like never made them and never made them and never made them and never made them. And then they put something out, but then anyway, like the Biden administration, like at the very last minute, then the Biden administration said, well, we're not doing any of, you know, we're redoing and doing our own where they could, but they said they're going to do this because, you know, it really actually dates back to when President Biden was vice president. So that is allegedly going to get ironed out sometime this year. And I know that that's good if you have groups in that space, because right now we've been kind of operating in a void. Some of these CAA requirements about exactly, you know, how we're going to do the like the data disclosure type of stuff with the RX and things like that. The surprise billing, how is that going to work? They're supposed to put out regulations on that this summer, and some of them, broker comp, they're only doing it for they only have to do it for the individual market. Mental health parity, they only have to do it for employers to complain, like where do you go if you think that your plan isn't mental health parity compliant. So transparency, they're going to put out more rules about how that advanced EOB works. So the advanced EOBs, the surprise billing, and the RX data, claims data disclosure, reporting 55,000 things, we will definitely get rules and more guidance on this summer. We may get more parity guidance. They did just put some of that out last week. And then we may get more broker comp guidance, but we may kind of be on our own other than for the individual market. But that's all going to come out probably this summer. We do have that case deciding the fate of the ACA, and that is going to come out probably at the end of June. There's a really good chance that they'll strike down the individual mandate and uphold the rest of the law. Who knows? I will tell you that very little of these things that I talked about today are predicated on the ACA. The only one that is predicated on the ACA completely is that data file, machine readable data thing that is based on ACA authority. And then some of the mental health parity, where it extends it down to the individual and small group market, is based on the ACA. Everything else we're talking about stands alone. So it would still happen. And I don't really think they're going to, I mean, maybe they'll repeal the whole ACA, but I kind of really doubt it. And then the other thing is that plan transparency rule has two other components. It also requires something kind of similar to that advanced EOB, but like different enough. And that is due, it's kind of due in two phases in 2023 and 2024. And it's really unclear. That's a final rule, so you have to do that. But then from the Biden administration, they need to do rules on that advanced EOB thing, and they're very, very similar. So we have to wonder, when they put out those rules this summer, are they going to do something to consolidate it? I'm not really sure. So those are just things that I kind of have on the, in my mind, that we're watching. So if you hear me, giving a presentation in the fall, maybe I'll be talking about some of these things. So you can just, I gave you a warning now, so don't be surprised. Like when new wellness rules come out in a couple months, you're gonna be like, oh yeah, I think I heard about that somewhere. And Lisa is giving me a really sweet time to do a shameless commercial. I will tell you, I work for MZQ Consulting, as well as having my own practice. MZQ is a full service employer reporting firm. We also do compliance services, which is what I'm in charge of all that. We're doing the mental health parity analyses for mostly like TPAs and health plans, but we will take employers on a one-off, but it's much easier if you kind of get it from the bigger end. So from a broker's perspective, I would be pushing on your TPAs and carriers to do it, because it's just ridiculous for an employer to have to do it themselves. We are looking into doing something to help you outsource the broker comp and the disclosures. We're waiting for more rules and trying to decide that. So that may be a product offering we have in the future. Right now, you can come to us for, all your wrap, notice, 5,500, all that standard stuff. And then we also have agencies, and we only work with brokers. And then we also have agencies that work with us, on a retainer basis, so that we can answer their compliance questions in detail, either on the phone or via email, that are specific to their groups or individual clients. But that's like a little commercial, but free. Like what I would say is, we have a blog. I write it with our CEO and one of my best friends, Jen Berman. We try to make it funny, and it's called Friends with Health Benefits. And you could just go to the website and subscribe to it. I also usually talk about it on LinkedIn, but sometimes I forget. So if you do it, I will say, I was putting this on here and I realized that the sign up thing is now really, really far at the bottom. So I'm gonna try and make the computer people move that. But right now, if you wanna sign up for it and get it in your email box, you have to scroll all the way to the bottom. But yeah, so this one that you can see right now, we did a little play on Friends, the TV show. So it's the one about mental health parity, because the Friends episodes are always the one with Ross and the couch or something like that. So anyway, that's our blog, that's MZQ, and I am happy to take any additional questions.
That was so awesome. Thank you so much. We really just addressed all the questions as we were going through it. I continue to get really positive feedback that they really benefited a lot from this. So please reach out to Jessica if you need any assistance, your clients need any assistance. Thank you. OCA actually was the sponsor. They're a TPA in the Northeast, and I think they're joining us for the state conference as well. I believe the invites shared that with you too. So thank you.
I know that OCA, I'm just going to say OCA and MZQ compliance partners. So OCA is our preferred Cobra Section 125, all the vendors. And we also partner with them. So if you're working with them on a wrap document, you'll be working with us. So I did not know that, but what great synergy. So OCA is amazing. And thank you for sponsoring.
Okay, with that, we are going to wrap up. We will make this presentation available. It was recorded. Karen posts it. So I will get that over to her once it's recorded. And thank you again, and have a great weekend, everyone.
Thanks, guys.